Welcome to Towards 2015, the program to broaden your business perspective in a large market with over 600 million consumers, which is the ASEAN market. It is as surprising as it is proud that Bangkok Hospital is the hospital with the most numerous branches in ASEAN. And now, their arms are open for interested international aides. Not only in ASEAN, what are the medical operations of Bangkok Hospital? Let's hear now from the CEO, Dr. Chatree Duangnet.
Welcome to Toward 2015. Today, on the topic of the AEC 2015, we are going to talk to one of the significant medical practitioner who's a vice president of the Bangkok Dusit Medical Service, who is going to talk to us about his perspective of the ASEAN economic community. สวัสดีครับ Dr. Chatree.
สวัสดีครับ สวัสดีครับ
Okay, so you are Dr. Chatree Duangnet, and today I would like to ask for your opinions and perspective on the coming trade barrier elimination of the region here in ASEAN. Okay, so what is your perspective of 2015 for medical industry?
First of all, our company perspective on the trade barrier lifting of the AEC 2015, we think it's going to be a very slow process. It's not going to be just like in 1 week, then
right.
we see everything just boom in front of your face.
Okay.
Actually, lots of things have changed already right now, gearing to that. So, in our perspective, the effect going to be slow, and the effect that will affect to our company is going to be not significant because we've been preparing for that since 2 years ago.
Okay.
For that event that's going to happen to us. The perspective to Thailand as a whole country, we're going to see some of the when the barrier lift, I would say good water from one side will flow to another side, depending on how well you prepare for this change.
Okay, so as an executive of a famous hospital here in Thailand, what strengths and weaknesses does Thailand in general, in terms of medical industry, what do we have?
Our strength would be the standard of healthcare of Thailand in general. It's pretty good.
All right.
Comparing to Singapore, Malaysia, and India. Our strength number 2 would be Thailand is a preferred place for people to come and visit and to live. If, say, we are a doctor from some other country, would love to come and live here and practice here. And
right.
Also prefer for patients to flow freely to our place also because of Thai hospitality and service standard. And standard of living is not that high comparing to some of the country. A weakness would be, I would worry more of our weakness of our country here is going to be environment. Number 2 would be infrastructure of technology. Number 3, education. And number 4, social standard overall. However, when the barrier is lifted, I feel that all those weaknesses going to get better because of we can learn, can bring all those the know-how from the other countries that is more advanced than us, like Singapore,
sure.
or sometime Malaysia, to come and then can lift all those weaknesses.
Okay, so we're just talking about the strengths and weaknesses in general.
Yes.
So what about your hospital? How are you bracing for the impact of 2015?
Yes, our company, since we are the largest network hospitals in Thailand and actually in Southeast Asia,
okay,
in ASEAN.
How many hospitals do you have?
We have right now 29 hospitals.
29.
And with 5,000 private beds, with market share of number 1 of listed companies
okay.
in ASEAN. So we are that big. So our strength in in AEC would be pretty strong. The risk of us being acquired by somebody else is going to be very little because we are so big.
Okay.
And with that, we also are very caring about standard of care. We have 11 hospitals in our 29 hospitals that are taking care of international patients, and all those we have them pass Joint Commission International, is the American standard of care. And with that, I think we have been prepared. On top of the size and quality, we've been preparing our personnel, which we think
right.
is will be the most important factor of AEC, personnel. So we have collected great numbers of great Thai doctors.
Okay.
Good doctors. Number two, good nurses. We have been collected very good, skillful nurses, and with lots of training.
Right.
Number three, good service overall. We try to do service just like 5-star hotels. And number four, good technologies. We acquire all technologies in the world that need to provide to patients at our group here. And the last one would be we have been setting up a very good referral system to make sure the globalization of patient to us and back home 360 degree is very smooth. So we have been preparing for that.
Okay. So on my way here before the interview, I noticed a lot of international patients, more than the other hospitals I've walked into. So can you please elaborate to me a little bit about how can you attract a lot of foreigners to be coming to the hospital?
Yes, it's our lucky. We are lucky in terms of standard of care of healthcare in Thailand is very high. We, after talking about good doctor, good nurse, good service, good technology,
yes.
After we doing that, we have been telling international patients that we have all this. Our quality of care is really internationally acceptable, just like any advanced countries. Right. And on top of that, we add on Thai hospitalities.
Sure.
And that's something very unique that no other countries can provide. And number three is we have Thai pricing. Even though it's a little bit expensive than India and up to par to Malaysia, but add on to Thai hospitality, they prefer to come to us. And last but not least, Thailand is a destination for tourism, for family, everything, they want to come here. So that's why, as a result, 31% of our income now are from patients flying in from around the world. Number one country would be Myanmar. And then number two, UAE, number three, Qatar, number four, Ethiopia.
Okay.
And then Bangladesh and Europe after that.